mental health and substance use related calls are among the fastest growing demands on police services right across the country. Unfortunately, most officers receive limited training to prepare them on how to respond to scenarios like that. But here in Ontario, the province has now mandated that all sworn police officers be trained in the Mental Health Crisis Response Program, or MHCR. It's a new program developed by Laurier University that aims to help police officers identify mental health crises, respond skillfully and compassionately, and also improve de-escalation practices to reduce reliance on the risk of use of force. Joining us live to talk more about this morning is Jennifer Lavoie, Associate Professor, Departments of Psychology and Criminology at Laurier University. Good to talk to you about this morning. You know, time and time again, in my business, we talk a lot about these, unfortunate incidents where, police officers are using lethal force, in incidents where we find out perhaps after the fact that maybe some better training, de-escalation. So how is this going to work? How is this going to roll out to officers right across the province?
Yes, thank you. The way it will work is that we are offering the training ourselves through Laurier University, but the primary way that we'll do this is, and have been doing it over the summer we've just started, is going to police services and training the instructors on the importance of going and training in service all police officers. There's actually 27,000 officers across the province in two things, really. The first is identifying signs and symptoms of mental health crisis, so that when they are on the front line and see that they're responding to a person who is in crisis, they can adapt their response and use strategies that are much more likely to be effective for those that are in crisis. People who are in mental health crisis might respond differently to tactics that are very effective in law enforcement, but not as effective in responding to a person in crisis.
So how much training do officers currently get, and how different is this going to be in terms of, length of time? I also understand there's a combination of live actors and even virtual reality here.
That's right. Yeah, it is a scenario-based program. It's very difficult to answer your question. Research shows that what police services have been doing, and services have been committed to de-escalation training for a number of years, but it's quite diverse across the province. So what this program does is makes the standard really consistent across the province. It's an additive program, so that there's different scenarios every year, and officers can work on growing and improving their de-escalation strategies over time. Scenario-based training is definitely a training modality that's very effective for police, and giving them an opportunity to rehearse. We do use virtual reality. There's also live actor scenarios as well, and VR. We partner with Street Smarts virtual reality, and these are opportunities where officers can get into scenarios that are high stakes. They're very realistic, and they have a chance to rehearse these strategies, so that when they get onto the road, they can continue to practice those skill sets, but that they're in real time. So having that chance to rehearse, how to talk to a person who's in mental health crisis, using tone, body language, strong communication skills, so that they have better outcomes on the road.
And it seems to me, Professor, that this benefits both the police and also the public in terms of potentially better, safer, more positive outcomes.
I agree. I think that the community has been very clear that they are looking for more compassionate, empathetic responses from police, and I think police want to provide that as well. And so I think it's a win for everyone.
Can you talk about I mean, this is the thing. We talk a lot. Our crime analyst Steve Ryan talks about police officers never know what's on the other side of that door when they respond to a call. They don't know what it's going to be. I can only imagine the kind of range of scenarios that officers have to sort of encounter, and how you either boil that down or sort of incorporate that into this training.
Agreed. Every crisis situation is different. Officers are going to often very ambiguous situations. There are risks that are involved, and so the more opportunity officers have to practice, especially early career officers. We've trained over 5,000 recruits at the Ontario Police College, and really getting these philosophies early on for younger officers is really important, in that And there's more tools than the use of force. So really emphasizing communication skills, empathy, compassion, offering choices to people who are in crisis is just more options for officers to use in order to respond to people in mental health crisis. These are the fastest growing calls across police services.
Just really quickly, has there been any pushback, or has this mostly been a well-received, well-incorporated program?
It has been well received. Police have been certainly focusing on mental health crisis responses and de-escalation responses for a long time. What this does, though, is that it's an evidence-based approach. It has the values of the community. It also has the values of policing incorporated in it as well. And as a result, it's been quite well received so far.
Okay, this is fascinating indeed, and it sounds like a great development. Jennifer Lavoie, the Associate Professor, Departments of Psychology and Criminology at Wilfrid Laurier University. Thanks for the time this morning to talk about this. Appreciate it.